So here I am at work on my day off. Doesn't matter, I'm here to help this little doggo, so let's get going. It was supposed to be my day off, but when you're the only vet in the practice that can do dentistry, day off doesn't really mean very much. And at the end, I'm going to be reviewing my Visconti Mandarin Breeze while I journal. This is going to be a raw, real glimpse into the stresses of veterinary life, a little bit about why we're running out of vets in Australia, how that's happened, the burnout, the stress, and what I do to still be loving this job after 40 years. So this is our patient, Sugar. She is a gorgeous little dog and we're just going to settle her in. She's had her pre-med, which is a mix of drugs that make the anaesthetic a bit safer, reduces her anxiety and is crucial in her pain management. Now, right now, we're just going to take some blood to make sure that all her organs can deal nicely with the anaesthetic, and we'll tailor a bespoke anaesthesia for her. Once the blood tests are back, we pop an IV catheter into her so that we've got easy access for IV fluids and bloods. And we're going to use that to just gently pop her under anaesthesia. She's a little bit wiggly, poor little thing. It's okay, my darling. Here we go. So down we go, gently, gently. And we're going to intubate her now. This is just a tube that's going to allow her access to oxygen and anaesthetic gas. And we're going to position her now to have her mouth x-rayed. X-rays are really, really important. 60% of a dog's tooth is hidden below the gum, so we're going to do full mouth x-rays. You can see the devastation that the plaque and calculus and periodontal disease has taken in her mouth, so we're going to be looking at these and deciding which, if any, teeth we can keep. Every tooth is going to be x-rayed, and you can see on the monitor there that we are actually looking at teeth with barely any bone attached to them. I'll give you a close-up of those very shortly. So we'll just keep taking these x-rays. So people seem to think that if a dog's mouth is painful, they'll stop eating. Not true. But the truth is that eating is hardwired into them as a survival mechanism, and these teeth are all too far gone and will all need to be extracted. So we'll just start by giving them a bit of a clean so that when we go in surgically, you will be able to minimise the amount of bacteria and infection that are going around there. And then I'm just going to gently start working on removing these teeth. It's going to take me a good 3.5 hours or so. These extractions are really essential. It's very delicate surgical work. It takes patience. We always use lovely multimodal drugs, cocktail of pain medications to ensure that she wakes up as comfy as possible. So we're just going to continue to look after this little girl, keep her nice and comfy. So the procedure's going along really nicely, and we've got pretty much all of the problem teeth out now, and for Sugar, that was all of them. So she's going to be waking up in a nice warm bed, and I'll be around until she's awake just to make sure that she's nice and comfy. So this is what goes on in terms of dentistry and extractions. This is nearly 3.5 hours work. I pretty much feel like I've run a marathon after doing this. You can see all of the equipment, the resources that are used, but it's all worth it. The source of her pain is going to be gone. You can see these broken roots. You can see all the abscess teeth there. So pretty soon she's going to be waking up. Sure, she's not going to have any teeth, but the gums will all be stitched over, and she won't have any pain after this. She'll have a little pain patch. She'll probably wear a cone for a couple of days, and she won't have any more infection in her mouth. So it's going to be great news for little Sugar. So here I am. It just doesn't leave as much time as I would like for a bit of a mental reset, a bit of clarity. I got to the park this morning with my dog, but I really do need to be journaling, so I'm going to get sorted. And I'm going to take you behind the scenes in this episode. You'll get to see what's going on in the vet clinic, what happens with a dental, and my work. And I'll talk about some of the stresses that are affecting the veterinary profession. So I'm here in our quiet room, just going to do 10 minutes journaling before I go and write my notes. It just helps me quieten my mind. It's been quite a chaotic sort of week already. Lots going on. This is a really, really busy time of the year. We're short-staffed like every veterinary hospital in Australia. We've got lots and lots of pets that need our help. So I've chosen this time just to do a bit of a relax, just 10 minutes, just brain dump, get some of the chaos out of my head. Then I'll go write my notes and continue on with my afternoon. I've got my beautiful journal where I capture just all the stuff that's swirling around. I brought in my Visconti Mandarin Breeze. I love this orange pen. I seem to have a real thing for orange pens at the moment. It's not an expensive pen compared to some of the other fountain pens that are around. It's beautiful orange resin. I think you can see here quite nicely, little candy sort of stripes, orange and yellow, a little bit of brightness and playfulness in my day. A perfect clip so that it fits nicely in my pocket. It's not going to fall out when I'm leaning over. And it's got a really easy cap to get off. So when I want to write notes quickly, there's no twisting. It's ready to go. It's super comfortable in my hand. I don't usually post or put the cap on the end. I find it just gets a little bit weighty. My hands do an awful lot of work with surgery and dentistry. So I like just the lightness of having it like this. It's got quite a gorgeous nib for a stainless steel nib. I'm really happy with it. So I'm just going to sit down, clear some of the chaos, just write a little bit about what's been going on this week. Having a bit of ADHD, which I think most vets do, means that we can manage a lot of things. We can kind of keep our head above water when things are really busy, but when it comes time, it can be really hard to switch that chaos off. And this is where journaling and just kind of the pen on the paper, the tactile feedback, even that little slight squeak of the pen nib on the paper just gives me feedback, and I can feel it slowing my heart rate down. I can feel it just making me feel a bit calm. So it just really, it's like a little internal massage in my brain. And the way a good pen, especially a fountain pen, just glides over the page, it just makes writing so effortless. And I kind of feel like my thoughts just come here like a little antenna straight onto the page. The nib just literally ice skates. No effort, I don't have to push. It's really lovely. I do love this pen. It's got everything I need to keep it handy and safe for work. It's got a great clip. It's got this little silver grip section here. The nib's really nice and big and juicy. It just writes really well. Journaling's my little act of self-defense in a really chaotic world where it's possible to get mental burnout. By popping things into my journal, it's just some self-care. It doesn't take very long. It helps me just get everything straight in my head because there's a lot to deal with. Being a full-time vet, running a business, having a life, keeping up with my friends, trying to hang out with my dog, doing YouTube videos. This is just my little bit of peace and calm. So one of the problems that we've got is the pet healthcare sector in Australia and around the world has always been stretched. There's not enough vets, there's not enough nurses. Along came COVID, and all of a sudden, more pets. People have got pets, they're at home more, they're spending more time with their pets, they've got a bit more anxiety. There's more and more pets to be looked after, fewer and fewer staff. And as a result of the stress and burnout, we've had a lot of people going into early retirement, people dropping their hours, or people even going into alternative careers and leaving the profession. So what has happened is we've gone from a stressful kind of situation, short of staff, to now it's really, really dire. So one of the things I'm going to ask is that people remember that anyone in healthcare, anyone in a service industry, they're already being pushed to the limit before you come in. And a little word of kindness just makes such a difference. If I have to deal with rude clients, I'm very lucky. As a business owner, I can choose to just send them away. I don't have to take that. But some people, they do. So please, if you can make a difference in someone's life, just by a kind word or just taking a breath before you lose it, it's going to make such a difference, because COVID and people's anxiety is what has put us into an even more precarious position. And to attract more vets and nurses into the profession, we're having to put up wages more. Costs are already going up. We're just getting into a really nasty spiral in terms of pet care costs. So please just take your time, take a breath. We're here to help you. We want to help you. That's why I'm still doing this after 40 years. It's why I still love it. But I'm very fortunate. I get to make the choice about who I get to see. So here we are, fewer vets, fewer nurses. Most of us are just hanging on by a thread, and we're doing it because we love what we do. So I would ask that please be kind to your vet. I don't know if you're aware of the mental stress that we are under. Everyone's under mental stress. Let's all be kind to each other and just make this job and everyone else's job the pleasant, fun, amazing thing that it can be. So if your vet looks a little tired, looks a little stressed, it's not because they don't care. It's because they actually care too much.